So what is a laminectomy? It's a very common operation that we perform. What a laminectomy is, it's removal of either all or part of what's called a lamina, which is the back covering of the spinal canal. And it's done so we can access the spinal canal and decompress nerve roots and the spinal canal itself when we have narrowing caused by problems such as herniated disc, stenosis, and arthritis that starts to encroach the nerve roots. All of it can be done alone with just a simple laminectomy where we don't put any hardware in. And sometimes we do this in conjunction with a fusion, which we went over earlier. It's a great operation to address primarily leg pain, particularly in our elderly population or older population. As the arthritis starts to encroach around the spinal canal and nerve roots, it starts to cause leg pain worse with standing and walking. And a simple laminectomy can oftentimes relieve the pressure on the nerves and allow the patient to return to function. Usually these operations can be done either outpatient or overnight stay through a very small incision. I'm going to show you on a model what we mean by lamina and laminectomy. So this model here shows the spine, and here's your sacral bone and your lumbar spine. These are called the spinous processes. These are the transverse processes. These are your facet joints, and this narrow bone right here is called the lamina. And when we do a surgery on the lamina, we either can open up a very small portion of the lamina to get access, or we can take off the entire lamina. The main structure of the spine is held by the facet joints and the discs, so removing the lamina is not causing instability in and of itself unless you have to remove too much lamina. Once we open a window into the spine, we can actually decompress the nerves that are coming out on each side, and also the spinal canal itself, which if you look down the tube here, gets encroached by the joints on either side and the ligament in the back. And so once we open that spinal canal up, it will take the pressure off the nerves and the patient can now stand and walk and function without pain.